All right, great. All right, well, thank you again, Patrick. So this will just be a brief overview of hypertension and hyperlipidemia, and primarily the focus here is going to be on kind of how you can educate your patients when they call. I know a lot of them have questions about, hypertension, hyperlipidemia. Most of our patients have these issues, so it'll kind of help you communicate with them and hopefully answer some of their questions. So we'll get started here. So just kind of general overview of who's at risk, what are the complications of hypertension, hyperlipidemia, what are our goals and treatment strategies, how do we monitor, and then again, educating the patients on diet and monitoring. Okay, so just first and foremost, what actually is hypertension? So a definition from the American Heart Association defines it as just the consistent elevated force of pressure moving through the walls in the blood vessels. So who's at risk? You've got some factors that you can change, some that you cannot change. Things that are non-modifiable are your age, your race, family history, to a certain degree, some comorbidities. The modifiable risk factors are the ones that we really want to educate our patients on to improve. So those are things like being overweight, sedentary lifestyle, try to get them active if they are tobacco users or alcohol users, cessation of those products, dietary changes, reduce the sodium in their diet, and then things to limit stress or reduce stress, such as exercising, reading, meditation, whatever that may be for that patient. So types of hypertension, I thought this statistic from the American Heart Association was pretty staggering, that nearly half of all the adults in the United States have a diagnosis of high blood pressure. In fact, this number is probably higher. Those just are undiagnosed. So there are two types of hypertension. There's primary and secondary. Primary is also called essential. That's the most common form of hypertension. And usually there's no identifiable cause for this, and it just develops slowly over many years. Secondary hypertension is less common, but typically that's a result of something, something else. So you have high blood pressure due to sleep apnea, renal disease, pregnancy, those types of things. So for those, you would treat the disease itself in hopes that the blood pressure would improve. So just complications of hypertension, it really can affect every body system. Typically what happens is, the chronic pressure against the blood vessels cause the heart to work harder. The longer the heart has to work harder than it needs to, then it's going to work less effectively. So a lot of times you'll hear hypertension being referred to as a silent killer, primarily because there are no symptoms of the high blood pressure, and these changes in your body occur slowly over the course of many years. So again, complications of hypertension, you can see the list below. You can have a heart attack, stroke, heart failure, kidney damage, vision loss, and then peripheral arterial disease. So what hypertension, with the increased force on the blood vessels and the arteries, you're getting kind of microscopic damage on the vessels. And with that damage, the LDL, so that bad cholesterol, can attach to it and form plaque along those little tears. And as that builds up and builds up and builds up, you can have these, more serious complications. This one, is kind of just more for a reference. If patients ask, well, what's a normal blood pressure? What's an elevated blood pressure? These guidelines are ever changing, so we kind of just need to make sure that we're up to date on the most accurate guidelines on what the recommendation is for a normal blood pressure. Something also to tell our patients is that blood pressure readings, when we're asking them to check them at home, we want to base it on the average of more than 2 readings on more than 2 different occasions. So the example below is, say they check their blood pressure 3 times a day. Those are the 3 readings you have: 126/72, 110/68, and 154/80, and you would take the average of those. So I think sometimes patients have a reading that's one reading that's high, and it scares them, it intimidates them, but really what we're looking for is the average readings throughout the day. So treatments for high blood pressure, first and foremost, is lifestyle modifications. So back to one of the earlier slides, those modifiable risk factors. So diet, exercise, weight loss, tobacco cessation, reducing alcohol, and then also reducing the stress. Each provider is different and each patient situation is different, but we'll typically try lifestyle modifications for a couple of months and then recheck the blood pressure before introducing drug therapy. But again, each patient situation is different, so we'll have to do what's best for that particular patient. This is another slide that's really more for your reference, and you can also use this to kind of help educate the patients on the phone or however you may be talking with them. And it just kind of goes to show you how those lifestyle modifications can help reduce your blood pressure. So none of these modifications are going to be, the magic trick to get your blood pressure under better control. They're usually used in addition to the medications, but I think it does help to give them an idea of, if I change my diet, I can reduce my blood pressure by as much as 11 points. So again, I'm not going to really go over this in too much detail, but it's more so as a reference for you to talk to your patients about. Sodium's a big thing for us to educate. This also goes into your heart failure. Really, anybody with cardiac disease, we want to reduce the amount of sodium in their diet. And I think a lot of times people don't realize that the recommendation for sodium in the diet is less than a teaspoon of salt a day. And if you have high blood pressure, it's even less. So some tips that we can teach our patients to reduce sodium: preparing food versus buying packaged processed foods. So preparing your own sauces, preparing your own dressings versus buying powdered products, those are packed with sodium. So if we can, tell them to go on the American Heart Association website, and there are plenty of different recipes out there of different ways to kind of flavor your food without using the packaged flavors that are packed with sodium. Also, fresh or frozen veggies are better than canned. If you do buy the canned, I know they're a lot less expensive. They can rinse off the veggies before eating them, and that will eliminate some of the sodium. So again, I know this slide's packed with a lot of information. I'm not going to go over it in detail as well, but it kind of goes over the most common medications that we use to treat blood pressure. You've got diuretics, your ACE inhibitors, your ARBs, calcium channel blockers, and then your beta blockers. I've given you some examples of the different medications that fall into each of those categories and then how they work with the body. The comment section on the last column, I think those are things that if you're looking through the patient's chart and you notice some of these things, just bring it to your provider's attention. One of the big things is ACE inhibitors and ARBs. They should not be on both of those medications at the same time. If you look at the calcium channel blockers, the most common one we use for blood pressure is amlodipine. One of the most common side effects of amlodipine can be pedal edema. So again, that's may or may not be a reason for us to discontinue or change the medication. It's every patient's it's going to be patient specific, but just know that that is one of the most common side effects of amlodipine. The beta blockers, they can lower the way they work is they lower your heart rate to reduce how hard the heart has to work to pump the blood, and that's how it lowers your blood pressure. Beta blockers can cause dizziness. So a lot of times we want to teach the patients to stand slowly or to brace themselves when they stand. All right, so common mistakes that patients make when they take their blood pressures at home. Um, a lot of times patients will take it either too little or too much. So going back to one of the previous slides, we really want them to take the blood pressure 2 to 3 times per day, and then we're going to average those readings. Sometimes if they take it too much, then they start to get an anxiety component about it, and that's really something we want to avoid is having them take it over and over and over in a certain period of time. Not supporting the arm. So really we want to tell them to be sitting still, support their arm with a cushion or a pillow to get the most accurate reading. Using a cuff that doesn't fit correctly or using the cuff over clothing will give you an inaccurate reading. Sitting on a bed with your feet dangling or your feet crossed, those will typically give you a falsely elevated reading. Something I think that people don't really think about is, drinking caffeine or using tobacco or exercising 30 minutes prior to taking their blood pressure, taking blood pressure on a full bladder, or doing other things such as engaging in conversation while you're taking it. So you really want to tell them to, be relaxed, no caffeine, exercise, or tobacco use for 30 minutes before, empty their bladder, and, just sit relaxed for at least a full 5 minutes before checking that blood pressure to give you the most accurate reading. So these are frequently used medications or other substances that may cause an elevated blood pressure. So again, things to think about kind of outside the box. Why is their blood pressure still high? Is it because they're smoking, a pack of cigarettes per day? Certain ADHD medications, antidepressants, antipsychotics, those can affect your blood pressure. Caffeine and decongestants certainly will can give you a falsely elevated blood pressure. Supplements, now there's a whole list of supplements, so I can provide those if you're interested, but a lot of times if patients are taking supplements, just kind of get an idea of what supplements they're taking. You can bring it to the provider and they can tell you if some of those supplements are more inclined to give you a higher blood pressure reading. Oral contraceptives, NSAIDs, recreational drugs, steroids, and then certain immunosuppressants can also affect your blood pressure. So follow-up time frame, this is going to be provider and patient dependent as well. But typically, as I mentioned earlier, when we do lifestyle modifications, we have to give them time to work. So we'll recommend lifestyle modifications for 3 to 6 months and then reevaluate. But again, depending on the patient's age, comorbidities, and risk factors, we may in fact check this sooner. When we start or change blood pressure medications, we usually want to have a repeat evaluation in about 1 month. Sometimes we prolong this to 1 to 3 months, again, to get that medication time to work. Okay, so a little bit about hyperlipidemia. So first thing is just understanding the lipid panel. So the 4 main components of your lipid panel: your total cholesterol, which is a combination of both the good cholesterol, the HDL, and the bad cholesterol, the LDL. A lot of times this isn't used in a lot of decision making because it can be misleading. So the 2 numbers we really look at the most are the LDL, which is the low density lipoprotein, which is also called the bad cholesterol, and then the HDL below, which is also called the good cholesterol. So the LDL actually makes up most of your body's cholesterol. Elevated numbers of this raise your risk of having cardiovascular disease or stroke. The HDL, which is your good cholesterol, actually absorbs the cholesterol and carries it back to the liver so that the liver can flush it out of your body. So you want a higher level of this good cholesterol because it can help you eliminate more of the bad cholesterol, the LDL. And then triglycerides are kind of in a category of their own. It's more of a fatty component. And typically when you have elevated numbers of triglycerides, it's due to an excess of calories or sugar in the body. And the body then turns it into triglycerides and it's stored in the fat cells. So when you increase your triglycerides along with the bad cholesterol or having a low good cholesterol, that certainly raises your risk for having any kind of cardiovascular disease or stroke. Lifestyle modifications for high cholesterol, very similar to the lifestyle modifications for high blood pressure. So exercising and losing weight will primarily work to increase your HDL, but it can also lower your triglycerides. Diet, this will work on kind of all of the above. It will work on reducing your LDL, reducing your triglycerides, as well as helping increase your HDL. Stopping smoking, and then reducing alcohol intake. A lot of times with your high triglyceride patients, reducing alcohol intake can significantly help. All right, so certainly there are more medications than these three, but these are our most common medication classes that we use for high cholesterol. Your statins, your cholesterol absorption inhibitors such as Zetia, and then your PCSK9 inhibitors. Statins are really our drug of choice in treating high cholesterol. There are multiple different options. There are high intensity and low intensity statins. The way the statin works is it reduces the liver's ability to make cholesterol, so it allows the liver to accept more cholesterol from the blood and thus eliminate more cholesterol. Statin's also cardioprotective, so what it does is the plaque that patients have, they have coronary artery disease, so they have plaque kind of lining their vessels, and it can help stabilize that plaque to help reduce the chances of it rupturing off and floating around and causing a heart attack or a stroke. With statins, your most common side effect is muscle pain. So they may complain of a soreness or a tiredness or weakness in their muscles. This is actually not very common. So 5% or less risk of developing a muscle pain with statin. But the symptoms can be perceived, or they can actually be, actually having these muscle pains. So a lot of times you'll see a statin intolerance due to muscle pain. So we would either lower the dose, or we may change to a different medication if needed. It can occasionally cause an elevated liver panel, so we will check that periodically if they're taking a statin. Zetia is pretty well tolerated. Zetia works usually in combination with a statin. It reduces the amount of cholesterol that the body absorbs from the diet. One of our newer medications are the PCSK9 inhibitors, such as Praluent or Repatha. And what this does is it enhances the removal of LDL by inhibiting this PCSK9 receptor. So the body's able to get rid of a lot more of the bad cholesterol. Again, this one's pretty well tolerated as well. Some people complain of flu or cold-like symptoms. They may be more prone to getting an upper respiratory tract infection, or they may have some sensitivity at the rash, some itching or some or site sensitivity. So they may get a rash or have some itching at that site. But really, these medications work very well to reduce the LDL. They can lower it as much as 60% in patients. This statistic is in patients who are also taking a statin in addition to the PCSK9 inhibitor. Okay, your DASH diet again. This is another one of those charts that has a lot of information, but it's good for, I think, just a reference point when your patients call to help them understand different ways that they can do those lifestyle modifications. DASH diet, what it stands for is Dietary Approaches to Stop Hypertension, but what they found is that this diet really can help improve your cholesterol panel. So it helps lower the LDL and lower the triglycerides. So what it focuses on is really fresh fruits, fresh vegetables, lean meats such as chicken more so than red meats, but really emphasizing on your fish. So your salmon, your shrimps, things like that. Nuts, almonds, sunflower seeds, kidney beans, different ideas to give them for little snacks throughout the day, limiting your fats and oils, limiting your sweets, using things like yogurt or applesauce instead of margarine or mayonnaise. Another thing you can include in here is the sodium that was on the previous slide, kind of spicing your meals with fresh herbs instead of sodium. again, there's lots of information on the DASH diet out there. I got a lot of this information from the American Heart Association website, but I can provide these little charts if you want to use them as a reference point to educate patients on different lifestyle changes they can make.